Hi, it's Dr. John Raymond Baker. I'm a chiropractic doctor in Longview, Texas. And today is March the 23rd, 2014, and I want to discuss in this video a troubling trend that I've seen lately. And the reason why I say it's a troubling trend is because I'm concerned with people's health, and I'm not concerned with insurance's bottom line. Now, the trend that I'm talking about is I've seen a lot of folks who get in car wrecks. They're approached by the other side's insurance very quickly with a check in hand saying, hey, let's get this settled. They don't really know how badly they're injured. All they're thinking about is, I want to get my car fixed. If I get a couple extra bucks in my pocket, I'm ahead of the game. Now, the insurance company knows that a lot of people after car wrecks don't know how badly they're hurt. If they've, for example, gone to the emergency room doctor is looking for life-threatening injuries, compound fractures, something very obvious. And if he doesn't see that, he doesn't take into account if you lose the curves in your cervical spine, the curves in your low back, that you will often develop osteoarthritis as a result of the change in the biomechanics of the spine. And basically, he's there to see, are you going to be dying? Do you need to be hospitalized? If not, then they're going to say, I'll let you go, give you some pain meds and maybe anti-inflammatories or antispasmodics, and that's it. So if that happens, you don't know how badly you're injured. You're just taking the word of the doctor, oh, you're fine. You know, that's it. And the insurance companies know this. They know that you're not aware that 20 years down the line you might have chronic pain, and they know that chronic pain that goes on for longer than 60 days can result in clinical depression, which is a psychological component to your injuries, just like you have a physical component. They look at you not as a poor injured person. They're going to try to do everything they can to see you get the best of care. They look at you as a liability. To them, you're red ink. They want to limit the liability, which means to settle the case as quickly as possible. And bottom line is they want your name on that bottom line. They want you to sign a release of further damage, further responsibility for them and their client. So what they don't want you to do, though, is they don't want you to see a doctor and be evaluated by a doctor who's aware of the often subtle changes in your spine, the kinds of things that can cause chronic pain and disability. They don't want you to talk to a lawyer because they don't want you to know your legal rights. The lawyer and the doctor that have seen a lot of cases of post-traumatic injuries in patients are aware that it could take years of treatment, that you may have to have surgery because something pops up that wasn't caught by the ER doc, but that is caused by the wreck. And they don't want you to be aware of those things. They don't want you to be fully informed. They want you just to sign the bottom line. And unfortunately, in these rough times economically, a lot of people that aren't aware of how badly they're injured. They want their car fixed, and if they can get a couple of bucks in their pocket, yeah, let's do it. But once you sign that bottom line, they're not going to be responsible if you have to go back to the doctor 2 or 3 times a week because you can't turn your head, because you can't bend over and take the trash out, because you're having to miss so much time from work that you get laid off or get fired. They don't care. They care about limiting their liability, getting you to sign on that line so that they're free and clear to go along their merry way and not be responsible for what their client caused you in that car wreck. And I'm all about the patient being fully informed as to their options for treatment, as to the kinds of problems they may be looking at in the future. And that's pretty much exactly opposite to what the insurance company is interested in. They want you ignorant and signing that line. So they would tell you, oh, you don't need a doctor, you don't need to talk to a lawyer, you just need to sign. Sign, sign, sign. And most of the times when somebody's trying to get you to sign something without being fully aware of why you're signing it and what you're signing and what happens if you don't sign. And so you have to be aware of these things. And if you're hurt in a car wreck, it's your body, it's your future that you're having to look at. So if somebody's going to offer you $2,000 for your injuries and taking care of repair your car, think twice about that, because you have to be responsible for your own self. Certainly the insurance company is not going to be responsible and take care of you for 20 years if that's the case, or 10 years, or they're not going to be there when you can't stand the pain, or you can't bend your neck, or you can't pick anything up. So think twice before you sign on the bottom line. It won't hurt to have a consultation with a doctor who's had years of experience. Like, I've been doing this since 1989, so I know a little bit about post-traumatic injuries. And they don't want you to talk to an attorney. So I would, be aware of your legal rights, be aware of how bad you're injured before you make any decision to sign on some dotted line and say, you're no longer responsible for my injuries. Have a great day. Thanks for watching my video, and I appreciate it. Bye-bye.